Distinguished colleagues and friends from around the world, I'm so sorry that I cannot address you live, but circumstances are such that we are hosting a family Moya Moya Day at my hospital exactly during this time slot, and I need to be available for that. Nevertheless, it is such a pleasure to address you on behalf of WFITN on World Thrombectomy Day. This is, of course, the 10-year anniversary of the 2015 mechanical thrombectomy trials, which were so transformative for our field, for public health overall, and for the life and functioning of each individual patient who has undergone this procedure, currently numbering at least in the hundreds of thousands, if not more. Mission thrombectomy was and is a call to arms that has focused on a clear and ambitious goal to provide timely access to mechanical thrombectomy for all patients who need it, regardless of geography or economic status, with the rallying call of no stroke left untreated. The underlying spirit here is that mechanical thrombectomy is not a luxury, it is a standard of care. This mission not only dovetails with WFITN's objectives, it is actually integral to who we are. WFITN was founded on the principle that interventional neuroradiology should be a global discipline, and that the transformative power of neurointervention must not be limited by borders, by income level, or by healthcare disparities. Our functional neurovascular anatomy courses rotate around the world, and they are solicited through the outreach of local teams that want to bring this kind of anatomy teaching to their trainees and young practitioners. Our mentorship programs and observership grants financially support young INRs from low and low middle income countries to travel to high volume centers worldwide to gain exposure and mentorship and to form lifelong friendships and relationships. Behind all this is the notion that practicing INR is not done in a vacuum, but rather as part of a community. And that community is strongest as a global community where we can help each other and teach each other. That kind of personal interaction, friendship, and teaching is what the WFITN Congresses, which rotate around the globe every 2 years, have been about from the very beginning. More recently, we have expanded this global vision from the level of the individual practitioner to the level of neurointerventional societies through the WFITN Federation Assembly, which was created to serve as a collaborative forum for neurointerventional societies across the globe. It brings together national and regional professional organizations, large and small, established and emerging, under one umbrella to share knowledge, align strategies, and build collective strength. By creating this platform, WFITN recognizes that through shared goals, joint training efforts, coordinated advocacy, and mutual support, we can create a powerful force for change. And in fact, the current focused project on which the Federation Assembly recently voted to undertake is precisely that of global disparities to access in neurointerventional care. In the case of ischemic stroke, we all know how dramatically mechanical thrombectomy has revolutionized outcomes, cutting mortality, reducing long-term disability, and restoring independence. But the availability of mechanical thrombectomy is so dramatically uneven across the globe. There is much work to do even in the best case situations, with access rates not really exceeding about 20% of eligible patients. But in many countries, the situation is far worse, with access rates in the low single digits. We really cannot accept this gap. The multifaceted way in which the Mission Thrombectomy team has taken this on systematically is therefore so impressive. Looking at the list of individuals and societies represented at this meeting on World Thrombectomy Day, I am so heartened by the inclusive model here that jibes so well with the WFITN approach and that can serve as a catalyst for more equitable growth in access to mechanical thrombectomy and to neurointervention worldwide. Mechanical thrombectomy is one of the great contributions of our field to global public health, and we owe it to every patient everywhere to make it available. Thank you all so much. Congratulations on the work so far, and I'm looking forward to seeing much, much more success going forward.